views and opinions expressed do not necessarily reflect those of Access Fort Wayne, the Allen County Public Library, or any other supporting groups. If you'd like to produce a show, call us at 260-421-1250.
Let me be your lighthouse so I can show you the way. Let me be your shining light, I'll keep you from drifting away. I'm the one that makes you try when.
Well, I'd like to say welcome to my television show, Patty's Page.
Well, thank you.
Yeah, and you are Leslie Friedel.
Friedel, yep.
Oh, I said it right.
Yeah.
You are at the visiting nurse and hospice. What's the last part?
Yeah, it's actually just visiting nurse, but it used to be visiting nurse and hospice home. So a lot of people know it as that, by the name we go by. We kind of shortened down the name when we started doing more things.
So whereabouts are you located?
We're located on the southwest side of Fort Wayne. We actually have 3 office locations, but where I'm at today is on our administrative offices, where our hospice home and our grief center are located, which are off of Homestead Road down in southwest side of Fort Wayne. Then we also have offices in Marion and Bern as well.
So you have a lot of counties covered.
We do. We cover 11 counties total. So we cover all the way north up to Noble and DeKalb County. We don't go into Steuben and LaGrange counties yet. And then we also cover down to Jay, Blackford, and Grant counties there along the bottom. So we cover quite an area.
And Allen County, of course.
And Allen County as well. Yep, Allen County, Wabash, Whitley.
Oh, yeah. Where did you start this visiting nurse?
Visiting nurse started in 1888, so we started here in Fort Wayne, and in 1888 it didn't look anything quite like what it looks like today. We had one person out on a bicycle just helping out in what was then called the sick poor, just helping people where they could when people weren't able to get out of their homes, and felt that it was just a mission that at the time that the one person did, and now we've grown into over 230 staff members, and we're out in cars going all over every day. So we've grown quite a bit since 1888. But we started, I think it's relevant to mention that, we started then, but we've served through the polio epidemic, and we've served through the Spanish flu, and now to come into the COVID-19 pandemic, we've been around, and we've seen a lot in our history.
Yeah, I know. It's almost like every 50 years a pandemic or something.
Mm-hmm. Yes.
Hey, is it every 50 years? I'm just guessing.
Yeah, I don't know.
So you're the CEO.
Yes.
And how many people working with you?
Well, right now we have about 230 employees that work for Visiting Nurse. In March, we combined organizations with Family Life Care, which did similar work as us, and they served an 8-county area, we served an 8-county area, and we overlapped in 8 of those, so we each gained a few counties. So when we did that, we have grown quite a bit just since March, so we have 230 employees now.
How many are in the executive leadership team?
There are 6 of us.
All ladies?
We have one male now that came with us in March from Family Life Care. Yes, we have our chief medical officer is Dr. Ann Moore, and we have our chief development officer Mary Shankster, our chief nursing officer Heidi Buffenberger, our chief compliance officer Coley Marshall, chief financial officer is Elaine Jones. So yes, a lot of females, and then our senior director of support services is Derek Bailey, who joined us in March and came as part of the combined organization with Family Life Care.
So when did you start all getting hooked up, networking with each other?
With Family Life Care?
Yeah.
Yeah, about a year ago, we started talking with Joe Byers, who was our board chair at the time, and I met with their board to talk about what kind of things we did. So many things, and had similar reputation, we had similar values as organizations. So we were their nonprofit as well, which isn't always that common in hospice. So having two nonprofit organizations in some of the competing areas didn't make a lot of sense. So we decided it would be better just to come together and do it together as one organization. And I think that's been very beneficial. It's been a short time. Of course, I think we were 6 days into the partnership when we found out we had the first COVID positive patient in our service area. So we haven't spent a lot of time focused on, we haven't had a lot of time to adjust to one another. We hit the ground running, I think, so what's happened. And it's been really, really positive, though.
Was there a lot of patients or residents having COVID-19, or just a few, or?
Yeah, so what I think happened was that people really heeded the direction of the governor and the CDC, and did a lot of social distancing, especially for those that we serve, because they're very vulnerable and their health conditions are really fragile. So I think we did a great job of maintaining the social distancing and making sure that people were just doing the right things to try not to spread it. But we did see some patients that had COVID-19. I think the hospital systems did a great job of getting people where they needed to be after, if they were to get better. But we weren't seeing it in the numbers that we originally thought, which was really great on the hospice side too. I think that's.
Are you on lockdown?
Are we currently?
Yeah.
We just came back to the office last week officially. We going back to the Family Life Care Partnership, we were trying to decide how we were going to work out of 3 separate offices, because Visiting Nurse itself had always had just the one office here in Fort Wayne. And within 2 weeks of that, we were all deciding how we were going to work out of 200 separate offices. We all had decided that we would keep each other safe and healthy by staying apart. So we decided to do remote work and dispatch from our homes instead of coming into a common office every day to try to not spread COVID-19. So we still had our hospice home up and running, and hospice home has the 14 beds of people that need extra care and need extra symptoms that need managed. Maybe they have a lot of pain or something like that. And so that has stayed operating the entire time, and we have been able to keep patients comfortable and in that unit, and so at times discharge them back home once they were feeling better.
Oh my God. Well, there were a lot of challenges because of this COVID-19.
Yeah, I think there were so many challenges. I think initially the biggest challenge was not having enough personal protective equipment. I mean, there was a national, worldwide shortage of that. So when we were trying to figure out how we were going to respond, we quickly realized that although we had stocked up some supply after H1N1 several years ago, we didn't have the supply if we were going to continue on an everyday basis to take care of COVID-19 positive patients. So we were trying to get as much supply as we could. So that was a major challenge for us, is to try to find supply of the personal protective equipment and get it to our staff. And so we were able to, and every time we put in an order, one really frustrating, which is happening to everyone, was that they would say, oh, it's on back order, or it was coming from out of the country and get caught in customs because there was just so much volume trying to make its way here. And then we also recognized that the lack of testing in the initially when we had staff that maybe naturally would have gotten, on any given day, there's staff members that are sick, but we couldn't determine if what they were sick with was COVID-19 or if it was just the flu or just a common, something that was causing an infection that gave them a fever, which we would normally keep them off of work. But the guidelines of keeping people quarantined for the 14 days initially was, we were having to do that with everyone because we didn't have access to the testing that we do now. So I think that some of those barriers are kind of, people quickly responded, the state quickly responded with the testing, and also, we saw a lot of organizations here locally even changing over to start making the personal protective equipment so that we could have supplies we needed. So a lot of the initial challenges definitely are much better where we're at today, and even a month ago where we were at, we're doing much better. and we've been able to get access to the testing we need and get the supplies we needed.
What is your mission?
What is our mission?
Yes, ma'am.
Yes, our mission is to take care of those that are experiencing life-limiting illness, and that's in a lot of different ways, and also focused on providing support to those after they've lost a loved one. So when we look at what we consider a life-limiting illness, we serve that in a lot of different ways. And most people know us for our hospice part of our organization, but we serve also through our palliative program. And our palliative program is something that it's kind of a new word coming around that people may not fully understand. So if you don't mind, I'll take a minute to describe that.
Yeah.
But what that looks like is somebody gets I'll give an example. Somebody gets a advanced cancer diagnosis, and they're trying to decide if they want to receive treatment or not. And if you decide not to receive treatment and your prognosis is 6 months or less, if you don't go for normal treatment, that would be a typical somebody that might be more eligible for hospice. If the person decides to seek aggressive treatment, during that time, they still may have the same symptoms associated with the person that didn't receive treatment, so pain, nausea, those type of things. And so we serve those through that our palliative program if they need that.
Oh, that's
So-
a difference. I never did know.
Yeah, and
Wow.
palliative focuses kind of on a couple different things. I mean, it focuses on symptom management, so palliating the symptoms, but it also focuses on advanced care planning. So what are the goals of that person that is going through treatment? If there's a period of time that they're questioning, should I continue dialysis? Should I continue receiving treatment for cancer? Should I continue receiving, if they have a congestive heart failure diagnosis and they're keep filling up with fluid and they don't want to continue to do all the process that takes to get that, do all of those things to feel better or to try to lessen the symptoms or the disease progression, those conversations can be had with our doctors and our nurse practitioners to talk about what's next. And so I think so our goal in our, go back into the mission statement, the mission of our organization is to serve those people and keep people comfortable and let them know about their choices, and also trying to keep, main goal is to keep people comfortable towards the end of life and informed. And then we also have our Peggy F. Murphy Community Grief Center, which is located on Homestead Road as well. It's it's only freestanding grief center in the area. And what we do there is we serve people after a loss. And that doesn't necessarily have to be connected to visiting nurse in any other way. But what that focuses on is caring for, we have 4 full-time grief counselors that offer grief counseling to the community at no cost. So anybody that's experienced a loss and we have grief counseling for them. And we serve people not just hospice related or people that have been through our services. We have individual counseling sessions and groups for those who have lost someone by suicide, or those who have had a recent loss or lost a spouse, things like that. We have all different types of groups and also offer individual counseling. So when we talk about what we do, we really try to take care of a person towards the end of life and then following the loss at our grief center.
So all these programs that you have, do people have to pay to be a part of them?
So I'll start backwards from how I just talked. So the grief center is at no cost to any individual. Hospice-wise, we have, typically that's a Medicare covered benefit. So if somebody has Medicare, then that is covered. Many private insurances cover hospice at 100%. So there's typically a payment source for hospice. And then palliative, same thing. It's covered by insurance typically. So if somebody needs, it's billed like a regular doctor's visit. So however that insurance coverage is handled.
So basically your patients in hospice and palliative, are they all older or young or in between? Or?
Yeah. So we have one day, I'm going to give this example at hospice home. One day we were serving somebody that was 4 years old and 104 years old on the same day. So we do have pediatric hospice patients, which is something you never want to think about and never want to experience. But I think that just having people that are there to take care of you in that moment of, that's some pretty terrible times, losing a child. And so we do take care of, we've taken as young as 6 months old onto our service. and younger, I guess. But as far as at hospice home, we've served a patient that was 6 months old. So they're not all older. They're all throughout the life. Unfortunately, life-limiting illness and doesn't happen just to older people. That happens all throughout the lifespan of different ages.
You have webinars. What kind of webinars do you have?
So one of the really interesting, we've done a few different webinars. So during the COVID-19 pandemic, during the stay-at-home order, we recognized quickly that grief for those, for people that have lost somebody during this pandemic was so different. Quickly recognized that. We recognized that funerals were limited to 10 people, and people weren't able to grieve like they typically would have been able to have that closure to say goodbye. Hospitals were limiting to either no visitors or only one visitor at the last moments of life. So many times people didn't get to go in and spend time with their family members, even if it was not related to COVID-19. So it's just that the hospital limitations. And then also in long-term care, we've seen that really a lot in nursing homes and senior living facilities where no visitors were allowed. And so we recognized quickly that grief when somebody lose somebody in that situation was very complicated and just different. It was showing up differently for people. And then also, I can talk specifically, one of our webinars was covering healthcare workers that have worked during the COVID-19 pandemic when they were taking care of people that they were their only person there by the side when they die, and the loss that they were observing in our local hospitals and our local nursing homes, that we offered a webinar about that. And we feel that was really important to get that information out there, even though we couldn't have a formal gathering of people. But last year we focused on educational series on substance use disorder and loss associated with that, and how that grief is completely different and shows up in different ways. So we've just focused and also what's happening here locally with the opioid crisis and what's happening with that. That was a focus of last year's series. And so we've just tried to focus on what's relevant and see where we can contribute to the community education.
Support. How many ways can my audience give, and why do you need support? You are a nonprofit, okay. So how
Yes.
do you get grants or?
Yes, we are a nonprofit organization, and as I talked about earlier, the Grief Center is at no cost to the individual. And also we have, I also talked a little bit about hospice and how it's paid, but many times, and sometimes there is no insurance or payer for hospice care, so we do a lot of uncompensated care. And so we really have a need to fundraise every year. We have a pretty large need, and a lot of our donations come in from either memorial donations or individual donors who give $5, $10, $15, $20, $50, and over the course of the year, that really makes a huge impact to our organization. So
on TV to do this campaign to raise money as well, or radio, or?
we do, we do some campaigns throughout the year. That's a good question. We do campaigns throughout the year. We definitely, we have a few events every year to try to raise funds. We do, at any given time, we have different things that we need for. So we need donations for PPE was a big one during the COVID pandemic, where we were asking, this was an unexpected spend of over $100,000 a month.
Wow.
And so as we were asking, people really were generous during that time and saying, we'll help you any way we can. And that way during the COVID pandemic was, which is still going on, I guess I should not refer to it as the past, when we were trying to get PPE, we recognized that if people couldn't give dollars, which not everyone can, that people started sewing cloth masks for us.
Awesome.
Yes, I have one right here that somebody made. I'm not sure if maybe one of your viewers made this one. And we're still wearing these in the office today. And those cloth masks went a long way. We couldn't get masks in especially for our family members. So if a family member that's taking care of one of our patients had to go to the store and didn't have a mask, we were able to give some of our masks to our vulnerable family members. So I tell you, donations have made such an impact on Visiting Nurse over the years, and especially this year. I mean, it's just been incredible to see how many people were willing to just give to support us.
Well, online I see a hummingbird. There's a hummingbird or a feeder. I just noticed that. It's only about that big. Oh, sweet. I was just going to, that threw me off. I was just going to say on TV and on Facebook, whatever, people are selling masks.
Mm-hmm.
On TV, it said about 10 masks for $30.
Yeah.
Might as well make your own.
I know. It's been, I tell you, and to give you an idea, we had over 800 masks donated. So just the people, the talent, the time that people put into this, I mean, that was just amazing that people, so you see the cost of those buying those masks. I mean, hopefully we were able to help a family member that maybe couldn't afford a mask that needed one. So
do they wash? Do they clean? What?
They do. We wash them and sanitize them. And we, even as staff members, if we're not in clinic, like I don't go as much out into the field so I wear one in the office to keep our other staff members safe in case that I've been exposed. So we just wash them and rewear them and to try to keep everybody safe.
At the hospice, how many patients do you have so far?
At the actual hospice unit we have here on Homestead Road, we have the ability to take up to 14.
14. And this coronavirus, you must be inundated.
Yeah, it's been an interesting time. I mean, we've seen, there was a lot of risk we felt with people that even as they were in their own homes, if their caregiver was exposed, you know, we were worried about what was going to happen with the loved ones. If that was if somebody was taking care of their spouse and the wife was taking care of the husband and the wife gets sick, what's going to happen at that point? So we've been really trying to balance how we use our resources here to make sure that we have enough space for everybody that needs us.
Do you have spiritual leaders or chaplains? Chaplain?
Yes. So we do have, we consider ourselves to be an organization of all faiths because end-of-life care is very important. Your faith is very important. And so we have 6 chaplains that meet with families and patients, and we've done wedding ceremonies. We've done a lot of things during end-of-life to make sure that we honor somebody's faith, tradition, whatever that may be. And we try to be very mindful of how to honor all faith traditions. And
these chaplains would be with the families all the time, or they have master course?
Yeah, they've had so we've even going into nursing facilities and things like that. We've really tried to talk about how important the chaplain role is at end-of-life care. So we've armed them with the same personal protective equipment that a nurse would wear going in, and have them going into the homes and into the nursing facilities too. They're a key part of this journey for people.
Without them, we need our spirits to be
definitely
at peace, because we know that we won't be lasting long.
Yeah.
It's good to feel at peace that you're going to be okay.
Yes, it's really an important piece. And we also have social workers that go to the homes and talk about some of those things too. Depending on what people's, if they don't have a faith tradition, just talking about what's happening at the end of life, what are their preferences, what are their, we spend a lot of time focused on when we bring a new baby into the world, we talk about birth plans and planning that, but little do we talk about, end of life planning, and not just necessarily who gets what, how this is going to go, but what does quality of life mean to each individual? And that's what our social work and chaplain team can really focus on, is talking about what does that really look like for each individual.
You get patients from all the hospitals in Fort Wayne?
We do. We do get patients from all of the different hospital systems in Fort Wayne, or the 2 hospital systems in Fort Wayne, DuPont Hospital, Lutheran Hospital, and Parkview Hospital. We we work well with all the hospitals, and we really pride ourselves on being independent from any health system, because we really value working with all of them.
Yes, I'm glad you do. I'm glad you're there. I see in my eye. So how many years since 1888 till now?
It's almost 132 years this year.
Wow, that's a long time.
It is a long time.
And you're continually expanding?
Well, yeah, we're going through our strategic planning with our board right now to try to decide what our next step is. This partnership with Family Life Care has been quite an expansion for our organization, just about doubled our size. So I think looking at what comes next is really key right now to figure out where we need to be and what communities need us going forward will be really important.
So what is your contact, email, phone number, how to reach?
Yes, so we really try to make it easy for anybody that wants information or wants to talk about donating, volunteering, any of those things. So our phone number is 260-435-3222. And when you call into that number, you'll get Christina or Susie, and they'll get you right to where you need if there's a question about maybe even just an information visit, what services are available, if you're interested in volunteering, grief counseling, our palliative clinic that I talked about earlier. So a lot of resource, that one number is the resource you need. And then also our website has a lot of information.
The website.
It's www.vnfw, so it's Visiting Nurse Fort Wayne, the initials, vnfw.org. We want you to feel people to feel supported when they call. So that is our main goal of trying to make things as easy as possible so that you don't have to question when you call in what you actually need. Because a lot of people, this is a tough conversation to start. Yes. And we want to make it easy for people.
What would you like to say to my audience to encourage them?
I would just encourage, I will get on my my advanced care planning bandwagon and prepare for things before they actually happen, and spend some time really thinking about, as I mentioned earlier, the birth plan we focus on, but what's the next step in life? And it doesn't have to be just focused on end of life, but be proactive in some of those things and reach out to the resources, especially Visiting Nurse if you need a resource for to look at some of those things and be prepared. Nothing's worse than a family having to try to guess what you might want at the end of life. So I would encourage everyone to really focus on advanced care planning and what type of things they need.
Plan ahead.
Plan ahead, yep.
Well, listen, my friend, thank you so much, Leslie.
Well, thank you, Patty. And thank you again for the flowers you sent out yesterday. They were beautiful.
God bless you, girl.
Bless you. Thank you.
This is the end of my show with Leslie Friedel.
Yes.
From Visiting Nurse, and we'll see you next week.
Bye.
Godspeed, my love, until we meet again. You're always in my heart and every dream. Don't let this time apart give in to all our fears. God will keep us close from up above. So until we meet again, Godspeed, my love. God is with us always for the rest of our lives.